The most common skull fracture is fissured or linear fracture, which is seen in autopsy. You can see this is a fissured or linear fracture, the most common fracture, fissured or linear. Now, my dear friend, the second fracture is diastatic fracture, which is due to sutural separation. As for sutural separation, as for most common suture is sagittal suture. It is commonly seen in young adult. So this is a diastatic fracture due to sutural separation. As for sutural separation, as for sagittal suture is most common. The third fracture is a depressed fracture, signature fracture or signature ala fracture. It is caused by a weapon which is a hammer. What is hammer? Hammer is a heavy weapon with small striking surface. So whenever it strikes, my dear friend, there is a fracture of outer table and inner table both, and that will cause depression, and it gives idea about the pattern of weapon. So what are the three names? Depressed fracture, signature fracture and signature ala. The outer and inner table both are depressed. Both are fractured. It gives idea about the pattern of weapon. FMGE Jan 25 question. It is a depressed fracture. Yes, very, very important. Hammer, the large weapon with small striking surface. This is a depressed fracture. Now I am coming to P for pond fracture and P for ping pong fracture. P for pediatric age group. But a very simple, wonderful trick is it is also known as intended fracture. It is It is seen in infant because of elastic skull bone. Another it is due to intact dura and intact inner table. Everything is in. That is an intended fracture. It is caused by obstetric forceps bled. So this is none other than very, very important. P for pond fracture, P for ping pong fracture or intended fracture. Pediatric elastic skull bone. Everything is in. Beautifully done. Now G for gutter fracture, G for caused by glancing bullet. What is the meaning of glancing bullet? Glancing bullet means oblique bullet touching tangentially the fracture in outer table. So this is oblique bullet touching tangentially and fracture in outer table. This is tangential bullet. G for glancing bullet, G for gutter fracture. Now comminuted fracture is caused by heavy blunt blow, and it is multiple intersecting line. You can see in the skull bone there are multiple intersecting line, and this look like a spider web fracture.